Hi everyone, my name is Miss Taylor. I'm playing the part of Miss Taylor. I'm a new patient at Facility X, and my nurse today is Eva Krawczyk. She is doing my physical assessment. She already washed her hands, took my biographic data, past health history, medications I take, family history, sleep patterns, functional assessment. So now she is going to, she explained me what she's going to proceed to give me a physical assessment. And she's going to assess my levels of consciousness and vital signs. So she asked me what my name is. My name is Mrs. Ann Taylor. She asked me where I am. I am at Facility X here in Chicago, Illinois. And she asked me what day it is, and I said it is Thursday. And the date is the 20th, and the time is 3:46, so I am oriented, she said, to times 3. I'm in good shape. Okay, now she's going to take my height and weight. So yes, the nurse took my body weight and height, and she says I am within the normal body mass index, which is good. She said that I look anxious and kind of my face looks in pain. I guess it's because after last COVID testing I had this eruption, eye infection, and it hasn't been healing for a long time. So now she is going to take my vital signs, and she's going to take my heart rate, my oxygen saturation. She's going to measure my temperature, my pulse, my respiration, blood pressure, and yeah. So yeah, she's taking my blood pressure right now. It seems a little elevated. It's like 140 over 95. And my oxygen saturation is fine. She just took it off the finger here. And yeah, so the heart rate, oxygen, temperature is all normal ranges. My pulse. Now we go on to the head, face, neck assessment. She says because I'm a little swollen on the left side, it's a little asymmetrical, but she wants me to smile and raise my eyebrows to assist with identifying the symmetry, and it looks okay. There's no involuntary movements or shakiness. Next, she's palpating my skull for bony contour. It's like genetic. I have like pillar cysts that probably have to be removed, she said, but that's a whole different visit, a whole different assessment. My hair, it's stressing, so it's like, like rough texture. Now she wants me to bite down, test my temple areas here, close to here. And now she wants me to close my eyes, and I have to tell her where she's touching me. So you're touching me on the left cheek, right cheek, forehead. Okay, I guess my cranial fifth nerve is intact. She's checking my trachea midline. She's palpating my carotid artery. My contour of the trachea seems okay, she says, which is a good sign. My thyroid is not enlarged, which is okay, which is good. She wants me to look up, look down, left, right, and she wants at a 45-degree angle where my nurse Eva is now checking for a jugular venous distension. At a 45-degree angle, the venous distension shouldn't be evident. Okay, so now she's gonna check the lymph nodes, and she's gonna check the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, post-cervical, and deep cervical. Supraclavicular nodes, intraclavicular, and so now they shouldn't be swollen, so they're not. Okay, so now we're going to turn the head side to side again, and the nurse is putting resistance when I turn, and if I can do that, she says that my 11th intracranial nerve is intact. Now she's playing resistance on my shoulder, and I could raise the shoulder, which is good. Okay, so the next step, she's going to look at my eye distribution. And she's looking for any droopiness of upper eyelids. She's looking for conjunctivitis. And if the pupils are of equal size. They seem that they are. She's going to use light obliquely to shine, to elicit a consensual response from each eye. And it seems like it's doing it. Now she wants me to look in the distance, and she's going to sparkle this light, and the sparkle should be even. Okay. Okay, now she's going to hold out a finger, and she's going to do these gaze to test my fields of gaze. I got to follow the finger. Oh, I did that wrong. Just my eyes. And then she's going to use the ophthalmoscope, and she's going to look closer in my eyes to see if the pupils are bilateral. Okay, for the ear and nose, she's looking for the shape and if there's any discharge. She's looking at the pinna. She's percussing the mastoid process. And now she's standing behind me, and she's whispering something. It's a good day. And I have to repeat, it's a good day. And now she's standing on the other side, and she's doing the same thing. She's snapping her fingers. See if I can hear it, and I can hear it. Okay, now she's going to check my nasal mucosa. If there's any discharge or blood, and it looks fine. My mouth. And the valvula rises at midnight. So the 9 and 10 are intact. I'm able to swallow. And now she wants me to repeat this phrase, light, tight, dynamite. Light, tight, dynamite. And it looks like my 12th nerve is intact. So that concludes that part of the physical assessment. We're going to continue to the next part in just a second.